more bone underneath this where the bone graft is, I think we're getting in good shape. So hopefully both of these guys will stay healthy. But you can see where we really want to just get in there and brush those teeth on a regular basis. Once this heals, I want these brushed every day. Now look at this tooth here. See that? Right there? A little tiny bit of, he just has this tendency right in the front of his teeth for whatever reason.
Do you see this
a little bit of periodontal disease.
Other dogs?
Periodontal disease is very, very common.
But on that aspect?
It's a little bit of an unusual presentation, I will say. It's kind of focally severe on those two teeth, and that's a really good, question as to why, and I don't have a great answer for it. But perio picks and chooses where it wants to be active. It just does this. So it's kind of annoying, but that's the way, the nature of that disease. But the nice thing is that the rest of his teeth, don't have a lot of major problems. They're really deep pockets or anything like that to talk about, which is good. So just these couple focal areas that we can try to, keep free of, plaque and calculus is the main thing. So there you go, guys. So that's the oral surgery part of things. So there is that.
So brushing it as soon as it heals.
Yeah, so about
Daily
14
brushing.
days, I think I'm going to have you guys start brushing again. There's another thing that we can put on his teeth called Oravet, and that's a dental sealant. It actually forms an electrical static bond to the tooth enamel, rendering it very slippery. So the coefficient of friction is decreased when you put that on there, and it makes it so the plaque and calculus don't adhere to the teeth as readily. So it slows that process down a little bit.
How often do you need to reapply? Or
Every 7 days. Yeah.
Okay.
Oh,
Okay.
and by the way, since you're an eyeglasses wearer, do not get this stuff on your fingers. It's best to apply with your fingers because it's kind of a hard, waxy type stuff. Almost like a really, really hard hair gel or something. But you got to kind of warm it up a little bit, and then I just slide it along the dental arcade like this, so you get the inside and outside at the same time. Once a week, but do not get it on your glasses. It forms a permanent bond to glasses, so you'll get a fog spot forever, and it'll ruin them. So I haven't had anybody do that yet, but I've had colleagues who have, and I know I pay for these, and they're not expensive. They're not cheap. It's $400 mistakes sometimes. It depends on what kind of lenses you have, but yes, don't do that to your camera or anything else. Just wash your hands.
Okay.
Okay. So I've got some of the Oravet in there for you.
Excellent.
The other thing I've got in there for you is chlorhexidine rinse.
Okay.
And this is something I'd like for you to do after meals. He's going to need softened up foods, and it says, of course, in his report there about aftercare. It's got a little zipper tube there, and you're not going to be, power blasting, anything off of here, but you've got those stitches to be mindful of and take care of. And so what this does is if you just get a little spritz in through here and a little spritz in through there, after meals would be great. So you can just keep food from clinging to them. It also helps to kill plaque, bacteria as well.
Okay.
So keeping the plaque.
So what about treats? And we do a lot of training with him.
Soft
I know.
treats for the next 14 days, soft treats only. And we're going to talk about his training. Okay.
Okay.
Because he has, he's got a really, swollen area, and he's got some painful joints. We're going to need to talk about getting these guys some pretty good, bed rest for the next 14 days.
Okay.
So really strict rest, no really long walks or anything like that.
So
Because he's limping, he's in pain. He's got that soft tissue swelling on the inside of
his right.
His right, and then the left has we've got some knee problems.
Okay.
Is what the radiologist is telling us about this.
Okay.
So I'm going to pull that up for you next, real quick here. It's going to be links radiology report. And I've written this also into my. You'll get a copy of my medical record from today.
Okay.
That's going to